in healthcare. So I'll turn it over to you, Dr. Hanekom.
Well, thank you very much, Pradeep. Good evening, everybody. I'm really pleased to be with you virtually, to meet you, to talk to you a little bit about my role within self-care. I'm a trained general practitioner, internist, and family physician who've had the privilege of practicing medicine in multiple continents and countries over the last 25 years. And I'm very, very pleased to join Pradeep and the senior leadership team in self-care to really make the world a better place in terms of healthcare delivery. In the most recent 20 years, I've had the privilege of serving as the Chief Medical Officer of a major Blue Cross Blue Shield plan in the United States. I have been a consultant and faculty for the Center for Medicare Services, which is a national payer in the United States. Most recently in a program to help practices transform clinical care, really with the following goal. My mission is to make sure that the voice of the patient, the physician, the other stakeholders, including the regulators, are heard clearly within self-care, to make sure that our solutions and our services meet the needs of our customers so that we can drive four major goals. One is to make sure that we enable the delivery of better care, one patient at a time, that we reduce the cost of that care delivery so that healthcare delivery systems can be more sustainable, and that we drive increased patient engagement and satisfaction, as well as physician or doctor satisfaction. It is critical that we have a healthy workforce to serve the needs of patients and families. Foremost, my role will make sure that the best interest of the patient is at the center of everything that self-care does. So as Pradeep and I have been speaking over the last few years and working together, we have realized that if we take the best interest of the patient always into consideration, no matter what we do and how we do it, that we can build better communities. I'm a passionate believer in patient autonomy and the fact that information that is generated by the health delivery system and all the stakeholders in the system really belongs to the patient, and the patient should have the right to share that information with their care circle, be those their family, their friends, their physicians, their therapists, their hospital partners, etc. And with that vision, blockchain is, in my opinion, the technology solution that can assure those things. Over the last few years, as I made a very large physician network with value-based contracts with multiple banks in the Phoenix, Arizona area, we have learned that if you create a win-win for all the major stakeholders within the healthcare delivery system and enable that with powerful patient and physician engagement that maximizes care coordination, that you can really drive better care at lower cost and drive the satisfaction that individuals gain from their work significantly. So I'm very, very pleased to be able to contribute to the team. I look forward to making sure that our solutions not only meet the needs of the citizens of Korea, but it's also fully integrated into the excellent standard of care that is currently being delivered in South Korea. You should be very, very proud of what has been achieved over the last 50 years in Korea in terms of healthcare delivery and outcomes, and you've truly become a leader in healthcare delivery across the world. Lastly, you have a very well-established medical and regulatory environment where you have evidence-based standard being delivered in terms of clinical care, and we will work very, very closely with Korean doctors and healthcare providers to make sure, for example, that any solution we put in your environment reflects the standard of care as espoused by organizations, for example, like Diabetes Association. Very pleased to be working with the self-care team. I hope to visit Korea very soon to start having those important discussions with the most important stakeholders. And as Pradeep has said, this is a mission and it's my passion. Healthcare transformation by putting the physician and the patient at the center and making sure that we create a win-win for everybody is the way by which we build communities and make sure that people live long and healthy lives and create a sustainable financial model for us to continue our work with the next generation who did that. So thank you for allowing me to introduce myself. I look forward to working with you all in Korea. And Pradeep, I'll gladly hand over to you.
Thank you, Dr. Hanekom, and we are delighted to have you. Ladies and gentlemen, any questions that you would like to ask Dr. Hanekom? If not, we will have him back on later, so we'll be happy to engage him through the video and let him handle any of your questions. Can we switch back to the PowerPoint, Anastasia? Thank you. So the next thing I want to talk about is what are we going to do here in Korea, right? We talked about great healthcare system, platform that can do a lot of different things, so what are we going to do first? So the next part of this presentation is why are we opening that office in Seoul? What's the point? Why are we hiring these people? The 3 country director of business development, what are they going to be doing? So our first and most important step here is to focus on chronic disease management, not primary care, not visiting the doctor. That's not your problem. The real issue we're going to focus on is chronic disease. So in Korea, there are 3 million diabetic patients, known diabetics, meaning people who have been to the doctor and have been told you have diabetes. Your government also publishes data that they believe there are 2 million who have diabetes but don't know it. So there's actually closer to 5 million diabetics, but 3 are diagnosed, 2 are not. That's a big number. And that's for a country that hasn't got that many people. You're not talking about a billion-person country, right? It's a big number. But here's an even more startling number. The next slide. In 2008, you had 2 million diabetics. No. So what happened? In 10 years, it went up by 50%, from 2 to 3. 50% increase in known diabetics in 1 decade. That's a big jump. That's a jump bigger than many countries. That's a steep curve. 50% more in 10 years. Now the thing about diabetes is, once you get it, you have it. You keep it. It's not going to leave you. So you got to do things every day, every week, every month. It's not about, I'll go to the doctor, get a pill, and I'll be better. No. You can manage it, but you can't just get better. You've got to stay at it for the rest of your life. Believe me, I know. I saw my father struggle with all his life. He got it when he was 26. So he struggled for about 35 years before he finally got it. But it's a journey that will shape your life. It will not go away. So there are diseases like this that are hugely important, but diabetes is close to my heart, and it's a very important issue for you all. So we are going to here today announce that we are launching a diabetes care network on the self-care platform in Korea, in Korean, for anyone who has or is at risk of diabetes. That is our first product, first solution, first care network in Asia, here in Seoul, here in Korea, for the Koreans. And when we are successful here, then the rest of the world is a bit open. There are 450 million diabetics in the world. Majority are here in Asia. Majority. 500 million almost. That's a large number of people who need to do things to take care of themselves every single day of their life. And it doesn't matter if you live in Seoul or if you live in a small town in China. This disease requires constant coordination. It's about diet, it's about sleep, it's about drugs, it's Medicaid. Prescription drugs is about knowing what to do. So remember at the beginning I said to you, I don't know my A1C, I should. I guarantee you, how many of you know what A1C is or equivalent of that, and how often do you get it tested or that you need to get it tested? I guarantee most of the patients don't know. It is not the fault of the doctor. Well, the doctor should have told me. No, it's your lack of actionable information that is personal to you. And that lack of personal actionable information is why we don't know. So our job to launch this diabetes care network is to engage the diabetics with their family, friends, co-workers, supporters, lovers, partners, spouses, to understand what to do. It's not just about, I can go to the doctor, they'll fix me. They can't fix you, but your family can support you. And the support of the family, the community, the employer is how you manage something like diabetes. And you can change diabetes to cancer, same issue. We can change it to heart disease, same issue. Chronic diseases require long-term care. Long-term care requires clear plan. Clear plans must be communicated and acted upon. Right? That's our job. So the Diabetes Care Network is patient-centric, accessible through the Care Wallet, and allows you to invite your friends, your family, your parents, your children, your spouse, people you care about, people who care about you, to support you in a very structured care model. Now, where does the care model come from? From the Korean Diabetes Association. That's the job of Dr. Hanekom, to work with the Korean Diabetes Association, study their published guidelines, apply them into a care protocol that sits in your wallet so it knows what you should be doing that you're not doing. And it makes everything real. So imagine that in your care wallet you get a card every morning saying, here is what you got to do to stay healthy. Every 3 months, it's time to go get your A1C check. Your A1C is too high, bring it down. Your BMI is too high, bring it down. Your blood pressure is too high, bring it down. If you don't know how to do this, here are your 3 options. Either meditate or go get a medication. Hopefully do both. And tell us if you're doing it. If you're not, your family, your wife is going to call and say, hey, I see you falling off the pattern. You're falling off the track. This is not good. We want you healthy and alive. So get you back on track. So it's not just for the... Healthcare isn't the job just of the doctor or the hospital, right? It's the job of your family, your friends, your children, your parents. We support each other to be healthy. We don't just grow up by ourselves and then we wake up and go, we are surrounded by people we like or love. It's a lifelong journey. So we're engaging your lifelong partners in it. And to design this care network, we are using the best practices of American Diabetes Association and the best practices of Korean Diabetes Association. And guess what? They're all almost the same, almost. So it wasn't that difficult to take the Diabetes Care Network from US and bring it to Korea, but we had to translate everything into Korean. Everything had to be made local and relevant to your guidelines. So we're very excited about this because once a network is launched, insurance companies can send their members here and say, join because you have this disease, we want you to help you. Employers can send their employees, hey, if you have this disease, I'm going to sponsor you so you can use this network. I want you to be healthy. I want you to be able to work and not let this disease destroy your career. Your children, your parents, your co-workers, your friends can sponsor members in it. The idea is, if you are a diabetic, you love a diabetic, or you care for someone, or you know of someone, then this network is where you send them to say, learn, act, get better. So we're very excited about this because this is the same network we've been building, or similar network that we've been building going into time in the US. But that's based on American Diabetes Association. Here it's Korean Diabetes Association. Tomorrow it'll be in Singapore as Singapore Diabetes Association. You see the replication? It can go every country with some minimal changes. And to access this network, you need the Care Wallet, and for certain services, you need the Solve token. That's what this is all about. So now, how do I access this Korean Diabetes Care Network? Well, through a Korean Care Wallet. So today, we're going to show you our Care Wallet that is being launched in Korea in native Korean. Because we don't expect you to access the diabetes